My first day on the job was the first day that we got a COVID positive patient. That first day, I just called everybody on my way in, everybody from marketing to Jeff Mead, our senior emergency management director, nursing, all of my senior team. And we just executed. Everybody did what they do well. People just came in and did whatever they could, whatever they had to, and said, what can I do? I want to help. And that's the attitude that everybody has and had through the whole time. The Phelps family is really very special. It's not just the way that we provide care to our patients, it's the way we provide care to one another. That's what gives us the family feel, I think. You know, love doesn't come in every health plan, but it certainly does come in this hospital. One of our patients' daughters called from Baltimore. It was during a period of time when we didn't have any visitation at all. And she couldn't come and see her father, who was in the ICU. In fact, both of her parents had been here, but her mother got better and was moved to a med-surg floor and eventually discharged from the hospital. But her father didn't do well, and he was still in critical care. And she called to thank me, but she said, can you tell him that I love him? I went right upstairs to the ICU, and I ran into one of our techs. Because I didn't have the appropriate PPE to go into the room, I asked her if she could go in and tell the patient that his daughter had called and said that she loved him. And she immediately, without question, went into the room, and I watched her kneel down and whisper in his ear that your daughter called and she said she loved you. And she stayed there for quite a time. And when she came out, I said, would you do that every day when you're here and let him know that? And she said, absolutely, and she did. And I'll never forget her for that. And that pretty much is representative of our staff here. There's nothing too much for them to do to provide care for our patients. They're wonderful in every aspect. This year's honorees, the Phelps Healthcare Heroes, the staff in the hospital are so important to our mission. And without them, we don't have that. It's not just the number, it's the quality of staff that we have. We couldn't have done it without them.
When you ask who are the healthcare heroes at Phelps, it's everybody. Everybody in every department across all spectrums of the organization. The biggest example of that was, and I get choked up talking about this, but every day, twice a day, we did a phone call. And one of the things, I coordinated the call, and one of the things we always asked every department was, how's your staffing? How's your sick calls? Do you need help? And every day the answer was, we're fine, we're fine, we're fine. Everybody just kept coming. They knew the challenges, they knew the threats to their own health and safety, but they were there. Clinical team, of course, had the biggest challenges and they had the biggest workload, but they weren't the only ones. Environmental services had a tremendous lift that, it affected them desperately. Materials operations, in terms of how are we going to get all the supplies in that we need. So we needed to reach out to other departments to help them, and those people stepped up and they were there.
It was very humbling. Being a part of someone's final days has always been a sacred gift for me, which is why I went into palliative care. This time was just different. It was beyond that. And not only that, not having families at the bedside. And so being present meant not just being present as a doctor, but being present as a daughter, being present as a mother, being present as someone in your family. And it went beyond me. What I saw was the ability of our team, the entire hospital, to take on everyone as family. We've always had a sense of community, of coming together. We've always had a sense of those that support the Phelps community, of always being able to continue to see the value in that. Because those that support the Phelps community, we can continue to be present and continue to share that love. It truly is a gift, and we really are blessed to have those that really value us and that we have their generosity to help us in these times.
To those people that support the hospital, we really can't do it without you. Your support means so much, not only from a financial perspective, but from an emotional perspective, recognizing the community is really behind the hospital and they really appreciate what we do. It means a great deal to everybody.
I guess if I had to say one word about the staff in the hospital, I guess it would be amazing. I just want to say thank you, donors, for all the support you give us. Your support means so much to our healthcare heroes.
Thank you so much for your generosity and support during our COVID pandemic.
Thank you.
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 Thank you. Thank you for your support.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you on behalf of Northwell Health Physician Partners.
On behalf of Clinical Services at Phelps, we thank you so very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you for your support.
Thank you for your support.
Thank you.
Thank you for all your support.
Thank you.
Thank you.
Thank you.
So on behalf of the medical staff that I represent, thank you very much.
Thank you.
Thank you.
On behalf of the Department of Support Services at Phelps Hospital, I wanted to say thank you for all your support.
Thanks for your support.
Thank you.
Thank you.
We thank you so much for all of your support. It matters so much to all of us, helps us to come to work every single day.
We are so grateful you stood with us and continue standing with us. Thank you.